Okay, this is the table. This is the head end of the table. There's this clear membrane we call the foil. That's what the patient lays on, and Gary's going to bring the foot extension on to put on the end of the table here. That can be put on, that needs to be put on prior to putting the patient on. When we do cysto or whatever, that comes off, and we have a loop that goes around for the drain bag. But, okay, and you'll want to have your table at the lowest setting so that you'll either bring your patients in on a gurney or in a wheelchair. Works really good to bring them in on a gurney so they're laying flat on their back, and then they slide on over to this table. When you have them slide over, real important you tell them not to touch the C-arm, because once again it's critical that that's not bumped or moved once it's set up. On the table there's a couple of little arrows that point. This is kind of the treatment area. Notice that's right underneath where the C-arm is. So when we put the patient on the table, we want them supine, their bare skin on the table, and we want to try and put the stone in this treatment area. And we want to try to put the stone as close to the center of the table as well, as far up and down. And we want it by these arrows, but we want the stone in the center here. So you may have to oblique the patient a little bit, move them to the right to do a left-sided stone, or move them to the left to do a right-sided stone. Do you have anything to add?
I don't think so. Once you actually have the patient on here, you're going to put water underneath them and make sure there's no bubbles against the skin, no dry spots, because you want to use full maximum time of all the energy that's delivered. I don't think so. I do want to, I have the control panel that you actually have for your table. Ours is, like we said, ours is completely different. So the way you're going to set up your table is a lot different. Your control panel, you're going to want over on this side of the table, only because your C-arm and your monitor will be on this side. Our control unit is quite small, and I'm looking at my control panel and the C-arm at the same time. With yours, the movement of the table is done a little differently. So I will try my best to help you to understand on how the movement works. The unfortunate part is some of these buttons are a little backwards. So let me see if we can get this set up so you can understand it. Go ahead and zoom in on this. If this unit was actually mounted on the this side of the table, away from the C-arm, the table movements for the patient would actually be correct, but it's really not feasible to do it on that side, because that's where you bring your table in and everything. You don't want to keep attaching and detaching your unit from the table once you have it on there. So you have to be in mind that when you're moving the patient to the head, it's actually towards the foot side of the table. During treatment though, sometimes you actually have to move the patient while you're treating. And in order to do this, there are two buttons. You have a side-to-side and a head-to-foot button on here. And while you're treating, if you just push that, you can move the table just a little bit as you need it during treatment, which is really, really nice. We don't have that capability in our table, which I kind of miss. With being able to use these buttons, you can actually control the amount of movement that you want on the table. You have the patient, the up and down for the table to raise up and down is here. Your treatment head movement, of course, is here, in and out. Your airbag button, this is going to be very important. Your airbag button is all manual. So if you want to image while you're scanning, you have to push this button and a little light will come on, and that's telling you that the airbag is up. While you're treating, if you're not imaging, you need to make sure that that's off, because you will lose approximately 50% of your total energy because that airbag's up. So during treatment time is when you need to make sure that it's off. These arrows here will tell you, with the reflector that's attached to your C-arm, will tell you in which direction which airbag will actually come up. It will be either the one that comes straight up from underneath the AP bag or your oblique in the Z-axis. This actually becomes larger, so you will lose more energy with that one up. This button here is your airbag cushion pressure. More pressure, less pressure. The number will come up here and tell you at what pressure level you're at. If you have a larger patient, you're going to want to decrease your cushion pressure to be able to get them closer into the Z-axis. Sometimes with a smaller patient you need to increase it to push them away from that treatment to get them closer to the Z-axis. This is your treatment speeds here, 60, 90, and 120. We've treated at all levels. We find that treatment level at 90 shocks a minute is actually the best. We get the best treatment out of that. At 120, kind of is shocking it so hard it puts a little air bubble at the tip of where your shock wave is going to be, so that kind of decreases your energy. So at 90 a minute actually is the best treatment time that we've found. And then all your gaining controls, Steve's going to have to go through with that with you, because it's got to have other equipment that's attached. Of course, your power button. With the energy that you deliver, the amount of energy that you put in, we recommend you start at level 3, because you don't want to start at a higher level, because immediately the patient, even though the patient's asleep, they're still going to feel it. So you want to gradually go up. We usually do, each level we do 50 shocks, and then we'll slowly move our way up. You don't want to go over level 7. Well, you can go to level 8, but most stones that are kidneys will break up at level 7. If you have to go to level 8, it's acceptable, more risky. Don't ever go to level 9 for renal stones. If they're in the ureters, level 9 is fine, but stay at specifically level 8 or less for a renal stone. You can deliver 3,500 shocks for level 7 in the kidney. Level 8, you can only deliver 3,000. In the ureters, you can go to level 9, and it's not as critical, but we still go 3,500 shocks, level 9 for a ureter, because you're still creating tissue damage, but you want to keep that to a minimum. Let's see. And of course your energy level, that's here. That it will tell you what energy level you're at as you go along. It can get a little confusing, so when Steve's there, he'll definitely go over it with you as best he can. So if you really have any questions, please write them down so you don't forget them, and Steve will be able to answer those for you. Other than that, I think we can then go to showing you on how the patient alignment and all that would be. Okay?